Can you imagine going through a heart attack completely alone, with no one around to help? It's a real and devastating fear, but knowing what to do in those moments can be the difference between life and death. Today, I'm going to teach you a simple and vital technique that could save your life in such a situation. Don't wait until it's too late. This information could change everything. Now imagine this: you're alone at home, it's a quiet evening and everything seems normal. You're relaxing, maybe watching TV or playing with your cell phone. Suddenly, a nagging pressure appears in your chest. It must be stress or tiredness, you think. But instead of going away, the pressure increases. In a matter of seconds, the pain begins to radiate down your neck, down your left arm, and suddenly a cold sweat takes over your body. Your breathing becomes heavy, difficult, and your heart feels like it's beating out of control. That's when it hits you: this could be a heart attack. What would you do now? Cough? Drink a glass of water? Get some medicine? The truth is that in situations like this, every second is worth gold. Knowing what to do and what not to do can be the difference between saving yourself and waiting unsuccessfully for help. In this video, I'll show you everything you need to know to act quickly in the event of a heart attack, especially if there's no one around to help. These are practical and well-founded steps that can literally save lives. Not just yours, but perhaps that of a friend, family member, or even a stranger. So stay with me until the end, because what you're about to learn could be the most important knowledge you'll ever have about your health. Now, let me ask you, have you ever been in a similar situation, or do you know someone who has had a heart attack? If so, you know how scary it can be. Tell me in the comments where you're coming from, and if you like, share your story. And take the opportunity to subscribe to the channel, because here we talk about health in a simple but powerful way. Every week, I bring you information that can make a big difference to your life. First of all, do you know how to recognize the signs of a heart attack? If you do, congratulations. Less than 5% of people are able to identify the symptoms in time. But if you don't know or have any doubts, calm down, because I'm going to explain them to you. The most common symptoms include a pain in the chest that feels like an enormous squeeze or weight, as if an elephant were sitting on your chest. This pain can spread to the neck, shoulders, back, and left arm, although in some cases it can also reach the right arm. You may experience shortness of breath, nausea, dizziness, or even a feeling of intense anxiety, as if something terrible is about to happen. In some cases, a heart attack can manifest itself in a more subtle way, such as mild pain or discomfort in the stomach, which many people mistake for simple indigestion. Recognizing these signs is crucial, because time is of the essence. The sooner you act, the greater the chances of minimizing damage to your heart and even saving your life. So join me now as I teach you exactly what to do if you're alone and suspect you're having a heart attack. This could be the most valuable piece of information you've ever heard. Let me tell you something important. The body is like a silent superhero that sends signals when something isn't right. The problem is that we often don't understand or ignore these clues. Today, I'm going to explain the most common signs that can appear before a heart attack. Pay attention, because this could save your life or the life of someone you love. Let's start with the first danger sign. But first, make sure you're subscribed to the channel, because there are lots more tips and valuable information here for you to take care of your heart. Don't miss a thing. First sign: dizziness or feeling faint. You know that dizzy feeling that comes over you all of a sudden, as if everything is spinning or you're going to faint. This can be much more than just a feeling of unease. When the heart isn't pumping blood properly, blood pressure can drop and the brain doesn't get enough oxygen. The result? You feel dizzy, weak, or even lose your balance. Now think of a woman who is in the middle of a busy day, feels that dizziness and thinks, "Oh, it must just be tiredness." It happens all the time. In women, this symptom is even more common than chest pain, and is often ignored. But here's a tip: if this dizziness is accompanied by a cold sweat or shortness of breath, don't wait. That's a red flag you need to take seriously. Second sign: heaviness or tingling in the arms. Have you ever heard the story that pain in your left arm is a sign of a heart problem? It's true, but it doesn't stop there. It can be in the right arm, both arms, or even the hands and elbows. Imagine that the heart is calling for help and sends this alert to the arms because they share nerve connections. The left arm is the most common because it's closest to the heart, but if you feel any heaviness, pain, or tingling, especially if it comes on suddenly, don't underestimate it. What's more, these symptoms can vary from person to person. So if you feel something strange in your arms along with another sign, such as dizziness or sweating, it's time to seek help. Third sign, cold sweat and pale skin. Have you ever started sweating out of the blue, without exertion or heat? What about that sweat that's cold, leaves your clothes sticking together and is accompanied by a frightening pallor? That's not normal, okay? During a heart attack, the body goes into emergency mode. It releases adrenaline to try to balance the situation, but this causes you to sweat a lot and circulation is impaired, leaving your skin pale. Think of someone who is at work, starts to feel that cold sweat and thinks, it's probably just anxiety. Don't make that mistake. This is one of the clearest signs that the heart is overloaded. Even if it seems simple, it's better to be safe than sorry. Did you already know this sign? Did it surprise you? Let me know in the comments if you've noticed anything like this in yourself or someone close to you. I'm curious to know, and I'll help you with more information. Fourth sign, nausea and motion sickness. Now, this one is interesting. People often don't associate nausea or the urge to vomit with a heart problem, but they should. During a heart attack, the ailing heart can confuse the body, causing discomfort in the stomach that feels like poor digestion. For example, imagine a person who has had a normal dinner, goes to bed and starts to feel strangely nauseous. They think, oh, it's the food I ate too quickly. But in fact, it could be the heart crying out for help. This symptom is especially common in women, and what's worse, it can come on its own or together with other signs, such as sweating or chest pain. So, if you feel unusually nauseous, especially when accompanied by other symptoms, be alert. These are just 4 signs that the body can give you before a heart attack. Are there more? Keep an eye out and share this information with your loved ones, because knowing these signs can make all the difference when the time comes. Fifth sign, nausea, motion sickness or even vomiting. You know that uncomfortable feeling in your stomach that makes you think, did I eat something bad? Or that sudden urge to vomit that comes out of nowhere. Well, that could be your heart sending out a warning signal. This happens especially in cases of diaphragmatic infarction, which affects the lower part of the heart, right next to the diaphragm. When the heart isn't getting enough oxygen, it can interfere with the functioning of the vagus nerve. This nerve is like a communication cable between the heart and the digestive system, and this interference can cause nausea or vomiting. In women, this symptom is even more common than in men, and unfortunately, it is often mistaken for simple indigestion or any other digestive problem. This mistake can delay diagnosis and the start of treatment. Another important point, in people with diabetes, nausea can be the only symptom of a heart attack. This is because diabetic neuropathy reduces the ability to feel pain, such as typical chest pain. So if this discomfort appears alongside other warning signs, don't underestimate it. It could be something much more serious than it seems. Sixth sign, shortness of breath. Now imagine this, you're doing something simple, like climbing a flight of stairs or even having a conversation, and suddenly you feel out of breath, as if you've just run a marathon. This is a very important sign that something may be wrong with your heart. This is because during a heart attack, the heart may not be able to pump blood efficiently. This can cause fluid to build up in the lungs, resulting in a feeling of suffocation or difficulty breathing. Many people ignore this symptom, thinking it's just tiredness or a lack of fitness. But if you notice that simple activities are making you breathless for no clear reason, such as the flu or intense physical exertion, seek medical help immediately. This feeling of breathlessness could be the first warning that your heart is overloaded. Seventh sign, extreme anxiety or a feeling that something bad is about to happen. Now here's a sign that many people don't associate with the heart, that inexplicable anxiety, that intense fear or the feeling that something very bad is about to happen. Many people who have had a heart attack report this feeling, as if the body knows something is wrong before we even understand what is happening. This symptom occurs because during a heart attack, the body releases a large amount of stress hormones, such as adrenaline. This can generate an exaggerated state of alert, causing this feeling of panic. It's important to say that on its own, this anxiety can be mistaken for a panic attack or just a moment of stress. But if this feeling is accompanied by other symptoms, such as sweating, chest pain or shortness of breath, don't waste time. Seek help immediately. The best known sign, chest pain. We come to the most classic and well-known sign, chest pain. When you think of a heart attack, It's the first thing that comes to mind. And no wonder, chest pain is the most common symptom. Generally, this pain appears as a very strong pressure in the center of the chest, as if something heavy were crushing the area. Some people describe it as a feeling of tightness or even burning. But here's something many people don't know: this pain can spread to other parts of the body. It is common for it to radiate to the neck, jaw, shoulders, back or arms, especially the left. This is because the nerves that connect the heart to the rest of the body can confuse the location of the pain, sending signals to these areas. Another important detail: not everyone feels this pain in the same way. In women, the elderly and people with diabetes, chest pain can be milder or even absent. That's why it's essential to pay attention to the other signs we mentioned earlier. Did you already know this sign? Did it surprise you? Let me know in the comments if you've noticed anything like this in yourself or someone close to you. I'm curious to know, and I'll help you with more information. What should you do in the face of these signs? If you or someone close to you is feeling one or more of these signs, especially together, don't wait to see if it passes. Every minute counts. Call the emergency services immediately or ask for help to get to the nearest hospital. And here's a valuable tip: stay calm. Take deep breaths, sit or lie down comfortably, and try not to move around too much while you wait for help. This can reduce the strain on the heart and help avoid complications. Hey, imagine this situation with me. You're calm, maybe watching TV or resting, and suddenly you feel a pain in your chest. It's a heavy pain, as if something very strong is pressing right in the middle of your chest. You think, oh, it must just be tiredness or stress. But then the pain starts to spread. It goes into your left arm, up into your jaw, down into your back, and even your neck feels strange. To make matters worse, you start to break out in a cold sweat, and your breathing becomes heavy, as if there simply isn't enough air. This scares you. And it's normal, because these are classic signs that something serious is going on. It's very likely that you're facing a heart attack. If this happens while you're resting, or even wakes you up in the middle of the night, it's even more dangerous. And if you have problems such as diabetes, high blood pressure, high cholesterol, obesity, or a family history of heart disease, pay extra attention. These conditions can greatly increase the chances of a heart attack. The most important thing here is, don't ignore the signs. Your body is trying to warn you that something is wrong. What to do if you suspect a heart attack? Knowing how to act could save your life or the life of someone you love. I'm going to explain what to do, step by step, in a very simple way. Pay attention, because every second counts. But first, leave your like. It makes all the difference to the channel and helps us bring you more quality content. Let's go. 1. Chew an aspirin as soon as possible. If you're feeling symptoms of a heart attack and you have aspirin nearby, chew and swallow one immediately. This is no small detail. When you chew the tablet, it acts faster in the blood, helping to prevent clots from forming. These clots may be blocking the flow of blood to the heart, which aggravates the situation. The recommended dose is usually 325 milligrams, 1 adult aspirin, or 2 children's aspirins of 81 milligrams each. But beware, only do this if you are not allergic to aspirin and preferably after confirming with the emergency service that you should take it. This small act can greatly increase your chances of recovery, especially if done within the first 30 minutes of the onset of symptoms. 2. Never, ever drive to the hospital. I know that many people's first reaction is to get in the car and rush to the hospital. Sounds logical, right? After all, you want help fast. But this can be extremely dangerous. If you're having a heart attack, the risk of losing consciousness or suffering a cardiac arrest while driving is very high. Imagine the danger of an accident for you and other people on the road. That's why it's safest to wait for the paramedics. They come prepared with emergency equipment and know how to act to stabilize your condition before you even get to the hospital. So, if you suspect you're having a heart attack, call the emergency services immediately. 3. Stay calm and breathe deeply. It's natural to feel fear and anxiety at a time like this. But here's the secret: stress only makes the situation worse. When you get nervous, your heart works even harder, which can worsen the situation. That's why it's essential to try to calm down, even if it seems difficult. Take deep breaths. Breathe in through your nose, count to 5, and release the air slowly through your mouth. Do this several times to help slow down your heartbeat and reduce the feeling of panic. Also, try to position yourself comfortably. If you can, sit or lie down with your legs elevated at a right angle on a chair or sofa. This helps to reduce pressure on the heart and makes breathing easier. 4. Avoid eating or drinking anything. You might think that drinking a glass of water or eating something might help, but don't do it. During a possible heart attack, eating or drinking can complicate medical procedures. For example, if you need some kind of urgent intervention, such as surgery or intravenous medication, fasting makes the doctor's job much easier. So, even if it seems harmless, keep fasting until you receive professional advice. 5. Acting quickly but calmly is the key. During a heart attack, every second counts. The heart is struggling to function without the oxygen it needs, and the faster you act, the better your chances of avoiding permanent damage. But acting quickly doesn't mean panicking. Stay focused on the steps we've explained. Call the emergency services immediately. Chew an aspirin, if indicated. Find a comfortable position. Stay calm and breathe deeply. Remember that paramedics are prepared to deal with this situation. Your calmness and attention to the steps will help a lot when they arrive. Why are these precautions so important? A heart attack happens when blood cannot reach the heart, usually because of a clot or blocked artery. Without blood flow, the heart begins to suffer damage, and this damage can be permanent. Now imagine that you follow these steps. Take the aspirin, stay calm, and wait for the paramedics. This not only increases your chances of survival, but also decreases the risk of future complications, such as heart failure. What can you do from now on? Knowing how to act is important, but prevention is even better. Take care of your health on a daily basis.
Eat a healthy diet.
Choose fruit, vegetables, and whole foods. Exercise regularly. Daily walks can make a big difference. Monitor your blood pressure and cholesterol. Avoid smoking and reduce alcohol consumption. Get to know your body and have regular checkups. You know what's amazing? With a few simple pieces of information, you can save not only your life, but also the life of someone you love.
Sounds huge, right?
But it's actually quite simple. It all starts with knowledge and preparation. Let's talk about it, shall we? Imagine that someone close to you is feeling ill. Knowing how to spot the signs of a serious problem, such as a heart attack, could be the difference between saving them or not. Here are the signs you need to commit to memory.
Dizziness.
Numbness in parts of the body.
Cold sweat. Nausea. Shortness of breath.
Sudden anxiety. Chest pain or pressure. If you or someone close to you feels this way, it's time to act and fast. Calling the emergency services should be the first thing you do. While you wait, chewing an aspirin, if indicated, can help, because it acts like a superhero that helps the blood circulate better. And most importantly, stay calm. It sounds difficult, but it's essential to help. Do you know why all this is so important?
Because time is the key.
The quicker you act, the better your chances of saving a life. Now it's up to you. Taking care of your heart is a commitment to life. Share this information with your family and friends. You never know who might need it. After all, knowing how to spot the signs and act quickly can be the difference between life and death. If you've been through something like this or know someone who has had a heart attack, let me know in the comments. Let's exchange experiences and together, create a network of support and awareness. And of course, don't forget to subscribe to the channel to learn more health tips that can transform your life. Thanks for being with me until the end.
See you next time, eh? Take care.